I'm delighted to welcome along Steff Green, who's our Enrich Cymru coordinator. So Steff heads up our research that we do across Wales in care homes. So to improve the situations that you hear some of those stories about, and hope to improve the lives for residents in care homes and make things better and connect care homes to communities and neighbourhoods and the like. Steff's done a great job over the last few years on her own, sorting out Enrich Cymru and enabling research in care homes to take place in Wales. But I'm delighted to say that the Welsh Government has supported us in the last few months to be able for Steff to be able to have a team to work with for the first time. So Steff's got somebody who works now in North Wales and somebody in South Wales, and I'm sure you're going to introduce us to them in your presentation, Steff. Just before you make a start, I will butt in just before noon to ask for a minute's reflection and silence in line with the national sort of minute of reflection. So apologies for stopping you halfway through before I do so, but I'll have to do that. So Steff, over to you. Thank you.
Thank you so much, Charles, for the introduction, and a special thank you to you, Mary, for sharing your story. I'm sure there's not a dry eye in the house. There definitely isn't in my house, including the cat. But it is really important, like Helena said at the beginning of the conference today, that we do capture people's stories because recognising and valuing the past will frame our future going forward. So I just wanted to start with a quick message of hope. So drawing on Helena's 3 words, love, strength and hope. The planet is beautiful and resilient, and so are we. So in my presentation, here we go, I'm going to talk through how we've been supporting the care home community, particularly with the role of research during pandemics and beyond. Please do follow us on Twitter and use the hashtag if you want to join in and make any comments. I'll try my best to keep an eye on the chat, but forgive me if I lose track of that. So, as an overview then, I want to be in keeping with CADR's conference theme and give you a background of the past development of the research network here in Wales, and talk you through obviously some of the challenges and opportunities that have been seen for care home research in this current pandemic. And then end on a very hopeful note about the future with my new team, and that there are lots of opportunities and developments in the pipelines. So it really is a time now for change. And if nothing else that has come out of this pandemic, care homes have risen very quickly up the political agenda. And that's why I'm so pleased that we have been funded to do this work here in Wales. So for those of you who are less familiar with what Enrich Cymru is, the actual word Enrich stands for enabling research in care homes. So it's a network to support care homes to be part of more research. And the networks have existed in a regional way in England for the past 8 or so years, and much more recently in Scotland. The Scottish Government has just literally started to fund a network there. A bit slower off the ground in Northern Ireland, but I have been in talks with them. And as Charles said, it was developed here in Wales a few years ago now, just with myself on part-time hours. And it was originally born from a consultation which the Wales School for Social Care Research carried out with care homes and practitioners and academics to really understand, do we need a network in Wales and what should it focus on? Well, very clearly, this consultation said it should be about the needs of the care homes, rather than it being a top-down, research-driven network. It should really have the care homes at the forefront, and I've tried my best to do this from day one. So that meant that I ran focus groups in the beginning with care home managers and showed them kind of the leaflets and the resources and the language I was using to develop this network in Wales, to do a bit of sense checking. Is this right? Do you need this? And all the way through then, I've endeavoured to develop these collaborative 2-way partnerships between the network and the homes. And I think that's where the real value is in the Enrich network in Wales being developed. And I'll just say that and it could be quite obvious, but the reason we need this network is because there are quite a number of challenges to carrying out research in care homes, some of which have become blatantly apparent during the pandemic. And historically, the care home community have been excluded or definitely missed out on lots of opportunities which have been afforded to other healthcare settings. So that's the driver really here. And I just wanted to touch a bit more upon the approach we take in Wales in the network. It's not about signing up every single care home in Wales to have a list of homes. It's about taking a genuine relational approach and building up long-term relationships. And this actually comes from some research. It was a systematic review a few years ago, which clearly evidenced that having long-term relationships with care home providers means you'll have a sustainable way of developing research, and you're not just going to be an occasional visitor, kind of fly in the night type person. So that's what we have at the core of our network. And most recently, we've published a paper around how best to build this kind of relational type of working in the research context. And that paper has just been published. It's still open access. I'll give you the link at the end of the presentation. We've also just written a blog about this sentiment through the Centre for Innovative Ageing, which kind of summarises some of the key messages. But I did just want to draw out one of the things that we talk about in the paper is that in terms of the pandemic, care homes have really been misrecognised or not recognised. I think Mary was alluding to that in her story. And this was from the very get-go. So even from before the pandemic was an outbreak, there was a sleeping suite of documents which had agreements and protocols in it ready for an outbreak, developed by the International Severe Acute Respiratory and Emergency Infections Consortium, the ISARIC, that's a mouthful. In those documents, hospitals and other acute settings feature very heavily, and long-term care facilities like care homes for older people were entirely absent. And this lack of recognition carried on through to there not being a care home representative on the initial advisory board for the government. And I'm sure we all know of lots more examples of how systemically that has care homes have been misrecognised or not considered as we've moved through the pandemic. So I just wanted to draw that out from the paper. I'm aware that we're approaching 12, so I will just go through this slide as briefly as I can, because I'm sure most of you know why we co-produce care home research, why we don't just say, oh, here you go, here's another study, here's another one, why we're so interested in finding out what priorities care homes have, because care homes are the experts by experience. You're doing this job every day and we're not. And this picture on the left is one of me when we were allowed to meet. Look how close I am to everyone. So there's some care home managers there on the table. And we were looking at end-of-life care as a research priority in care homes at that event. So why we do this is so that we have the most relevant questions and issues to the care home community. It's so that we include all residents and they're able to understand resources, and that we have the most appropriate methods and measures. And these seem obvious, but I will explain how these conditions haven't really been met during the pandemic. And Charles, I think that might be a good place to just pause momentarily.
Shall we have a minute of reflection and join the nation in thinking about it the previous year? So join us again in a minute. Thanks, Steff. That's probably a minute done if you want to carry on.
Okay, thanks very much. Yeah, so just to recap, it's so important to be working side by side with care homes to produce and develop new research so that the research is relevant and it can be useful in practice. And I know that does seem like an obvious thing to say, but I will explain a bit more about how that's played out in the pandemic as we move through. And as we develop the network, and now I have a team, we will be offering many more opportunities for this to be happening. So moving to more current times, I suppose, and as Helena so eloquently put it, there have been both challenges and opportunities. I think probably the biggest challenge in terms of research in care homes is the idea that care homes have been not recognised, and the rate of progress in which we've seen studies being developed. Like I said, hospitals and other acute settings would have been researching almost the day after we had the outbreak. But we didn't see the first trial in care homes set up until months down the line. So that's the principal study funded by the NHR, which is a great trial looking at different treatments for older adults, including those living in care homes. So that's exploring different types of treatments for when people have developed COVID already. And there have been some really important results coming from that trial. However, one of my main jobs during 2020 was to lobby the principal trial team to ask why aren't we including residents who lack the mental capacity to consent to being part of this research, because we know that excludes about 75% of the care home population, which is just unacceptable. And it's only within the last month or so a year on, that residents who lack capacity to consent can now take part. And obviously we are celebrating this from the rooftops, but it's not good enough. We also have the Protect trial now, which has which is open for recruitment since the start of this year, and that is looking at prophylactic treatments or measures which might help prevent the transmission of COVID. Also a very important trial. Even alongside the vaccines, we know that we still need to be looking at preventative measures. So this one is run by Nottingham University, and it will be it's pan-UK, across the UK, funded by the NHR, and very important study too. But this does leave us with important questions throughout this sort of pandemic, is that who is setting the research agenda and how can care homes contribute to this agenda? On my limited hours that I've been employed for in the last year or so, I've tried my best that whenever a study team contacts me, I will always send it out to the network of homes we had registered at the time to say, what do you think about this new study? Do you have time to input and kind of guide them about their questions and their methods? And I think that is not only important, it's completely essential that we're doing that kind of a process, so that we're not left with studies which kind of exclude the people they're trying to help. Other points about the challenges, I just wanted to mention that kind of the scale of the population, in case you're not sure about the population in Wales. Most recent figures from the Older People's Commissioner's report suggest we have about 15,000 residents and 65,000 workers. That's 80,000 people already, plus family, friends and loved ones. So we've touched on a lot of the challenges for care homes, but let's just keep in mind that it's just affected so many people in so many ways. And going forwards now, we need to bear in mind these questions about who should be setting this research agenda and how can we contribute. And I wanted to touch on the OPC's report that they published last year. And I just love the phrase experts by experience, because it just sums up the care home community. They're doing this job every day, and we should be listening to them as much as possible. And so I'm really so grateful again to Mary for sharing her story today. So this report by the OPC was very timely, and it was very illuminating about some people's stories. And I've got the link to this report at the end of my slides as well. They did over 120 engagement sessions. That was either on the phone or face-to-face where possible. And they really did put the older people's voice, or the care home voice, at the forefront of the agenda at the time, making sure that those stories are feeding into policy and decision makers' workload, so that they know what's happening on the ground and having it feed in directly to decisions. And that's where research comes in. We hope that the evidence that we're able to contribute also feeds into this policy making. Okay, so the role of Enrich Cymru has rather been evolving during the pandemic. I spent a lot of my time writing a business case along with Helen Grindle from the Health and Care Research Wales Support and Delivery Centre. I hope she's on the call. I couldn't have done it without her support. And we had the brilliant news around May or June time that we could keep evolving. So that was fantastic. So some of the things that the network has been supporting, like I mentioned, it's had an advocacy role. So to keep fighting to get the voice of care home residents in various research that's been developed. Sense checking, so we've had things like resources being developed for care homes by the NIHR. They called them top tips for tricky times, I think. And so when that was sent to me, I immediately sent it to the Enrich Cymru network because I couldn't possibly say I was the expert. I have previously worked in social care, but I'm not working in a care home now. And so I had the experts kind of sense check, things like that. Supporting new research. So care home research has rather been like waiting for a bus to come along. We've had just been almost inundated with new research being developed. So things like the use of PPE and all sorts of things. So every time a study proposal's come in, I've tried to get some care home managers' input as best I can. Communicating the value of the role of research, and as the profile of care homes have risen up the agenda, so has the area of research in care homes. And I would draw your attention to that call to action paper I mentioned. And I think that Helen has actually shared a link to it in the chat. So thank you so much for that, Helen. So we really do need to be championing how valuable research can be in getting us out of this mess, basically. If we can recruit the principal and the protect trials, we're going to be a lot further forward in having treatments and preventative measures, etc. And so we do need to communicate that message quite clearly. And also cascading information about new and developing studies. I've tried my best to do this by sending out emails, but now we have the new team. We are working on a fancy newsletter, and we'll have the website for Enrich up to date now on the Health and Care Research Wales website. So those are kind of some of the things that have been happening. As we go forwards now, we'll be supporting a care home in North Wales, in Llangollen, called the Old Vicarage Care Home, and they've been doing some fantastic work. It's made the news several times. And Beth, the manager there, you can see her little quote. It's all about supporting their residents to be part of the wider community, which we've seen during lockdown. I think that people want to reach out and be part of and connect with care homes. So they've done a lot of work around this, including writing a book called Lockdown Legends. And that is a fantastic way of residents to be able to share their stories. And then looking to the future, we'll be supporting a project called Rise Up from Lockdown. And that's really looking at how we open up safely care homes and sort of any issues and support that's needed around that. We're a partner with the Rare Quality of Life Network there, working on that project. And this is a really good example of where that project's being developed from the care home upwards rather than the other way around. Not to say that there isn't a role for other types of research, but we need to be supporting much more grassroots research, I believe. So lastly, and most excitingly, for me, Christmas was a letdown, but my Christmas came later when Sonja and Emma joined the team in about February, March time. So Sonja on the left is based in North Wales, and Emma on the right is based down in South Wales, also part-time with CADR, and their contact details are below. I know I'm probably running way over time, so I won't embarrass you and ask you to say hello, but they are on the conference today, and I just want to extend a very, very warm welcome into the team. And so looking to the very exciting future for Enrich and supporting care homes now, it really is a time for change. Like I said, care homes are very high on the agenda, so is research in care homes, being supported by the Welsh Government funding. In the next couple of weeks, we'll have our first advisory group meeting, which is like my second Christmas of the year. And we've got representatives from care homes, academia, lay members of the public, as well as CADR and Welsh Government. So that is going to be a great day. We will be supporting many more opportunities to co-create research, and I would encourage any homes who might be on the conference today to get in touch. Please do get in touch if you're interested if you've got any ideas, because like I said, you're the experts by experience. We're looking at lots of ways to be a bit more accessible in our engagement with care homes, writing blogs, and I put at the bottom there, we've just created a Teams channel for care homes to increase engagement. So we're hoping that's going to be a really quick and easy way for homes to engage. And lastly, we'll be working on a series of seminars. So the first one will be with CADR in July, looking at the hottest topic, which Mary has talked about. How do we go forwards in supporting care home visits in the UK? And I'm pleased to say that the Enrich Network is part of the UK SAGE evidence group. So we'll be able to share some of the learning from that group, and they draw on national as well as international evidence. So we're hoping to share lots of creative ways that care home visits can be supported in a safe way. So lots and lots to look forward to, and all of which will contribute to Helena's vision to leave no one behind. So as we come out of this lockdown, as we come up for air, I'm coming up for air with my new team, and we will be taking the care homes forwards together. So please do get in touch. My details are at the bottom. I'll put a message in the chat, or go on Twitter. I've just left those references there for your interest. So thanks so much. And I'm conscious I've gone over time. Sorry, Charles, but I was allowed an extra minute because we paused.
Absolutely fine. Thank you, Steff. You're doing some great work there. It's good to see it all coming together at last with your team. So welcome Emma and Sondra as well to the team.